essentially may have been anywhere else in your body to make sure that's the function of chemotherapy. Essentially, your surgeon disease can take you away from chemotherapy. Essentially, rectal surgery or liver surgery, something else could be start to grow. So even with this spot in your liver, we typically recommend starting with chemotherapy first and get pictures after about 2 months of chemotheraphy and seeing how you're responding, and then going through surgery. And the function of chemotherapy again is to treat your entire body and making sure that if there is any cell out there that is floating around, that is also getting zapped and controlled at the same time as we're addressing the disease in your liver. Okay. So that would be the recommendation is typically about 2 months of chemotherapy, come back with a CT scan, we look at the response, and then we give you a date to get this thing out with surgery if that's what you want.
Okay.
What are your questions? Or your
I don't know questions.
no questions yet? Don't come, and feel free to ask us, okay? Because we want to provide all the information and making sure that you're making the right decision based on the information you're receiving. Do you have any reservation about surgery, one way or another? Are you open to Dr. Newhook resecting this tumor once we get control with chemotherapy?
Mm-hmm.
Yeah, okay, all right.
Have you ever
I mean, well, because if I don't get the surgery, then what would happen?
So the other option is chemotherapy, just continue chemotherapy. Other options are you can have that area radiated, which is not the greatest option if you have surgery as an option. Based on location, sometimes you can do what is called ablation, which is targeting the lesions or the tumor with a needle percutaneously across your abdomen. You'll be sleeping.
Mm-hmm. Okay.
But you go in with the needle almost like a toothpick going through a grape, and the grape is the tumor, and then you kill that grape with heat. And that's done by interventional radiology. But I will need to confirm with Dr. Newhook if that's applicable to you, because at times, based on the location of the tumors, it can be hard to target those area with a needle. But it is resectable. It can be removed with surgery, so that's
So it's either surgery or stay on chemo for
right.
forever, or
So not forever, but essentially we know that based on the data and research is that chemotherapy does not kill cancer, it just controls and just control essentially cancer. So yes, theoretically it's forever, but most of us cannot handle chemotherapy forever because it's very hard on the body.
Yeah.
So typically your oncologist will do about the package, which is 6 months of chemotherapy, and then go on maintenance therapy, and some people take holidays, like 3 months off of treatment, and then go back on it, back and forth. So that's for when these patients and their disease is not resectable or they don't have any other options. You do have those options. So essentially with surgery, the hope is that we get control, we take it out with surgery, and then perhaps we don't need to do any active treatment because there is no evidence of disease, and we do surveillance with scans every 3 months until year number 5. So essentially, I don't know if your question or it's in your head, but one of the questions most of our patients ask is this cancer going to come back? And the answer is yes. Majority of our patients, despite chemotherapy, surgery, or any type of treatment, cancer will come back for over 50% of our patients. And that's just the nature of cancer itself, and the fact that it's not enough to travel. The hope is that you're resetting the clock as quickly as possible. So the surveillance, the scans that your team will recommend every 3 months, and we would recommend that as well after surgery, is to watch out, to actively watch and making sure that there is nothing. And that if something comes back, we catch it quite quickly, early, which is your case, and it's able to be addressed with minimal, well, it's not minimal because you're gonna need surgery, but essentially there is that you have more options when you're able to get things compared to when you have have like multiple, then you may have minimal or limited options.
Okay.
I can do that. How do you do that? Who am I talking to? How old is she?
She's 3.
Oh, she's adorable. What other questions do you have?
Mama.
So,
Mama.
recommending how many months of chemo?
Mama.
About 2 months,
Mama.
typically. So either 4
Mama.
cycles or 6
Mama.
cycles before the new
Mama.
babies.
Is that pills or?
And it'll be kind of the same thing you had before you call the surgery. It's either that or
Mama.
a different drug, but it's infusion.
Mommy.
Now, all of that, the final decisions are made with your medical oncologist. Sometimes they may do a pill and infusion, and that will be fine too.
Oh, okay. Same medicine or is it stronger or?
So you had the first line of folfoxiri, which is 3 drugs, right? You had 3 drugs. Okay. So typically we would either just do 2 drugs, folfox, with an additional drug for targeted therapy called Avastin, or the other. I don't think you need the 3 drugs. But again, we're not the chemo doctor. The medical oncologist is the doctor who makes these final recommendations, but that's generally what our patients go through, is doublet, not triplet with what you had. And triplet is good actually for when you started, but double should be okay with the Avastin. Avastin is important and helpful to protect the liver and to make the chemotherapy work harder in the liver,
Okay.
which is kind of where we're targeting right now.
Okay.
Good questions. Any other questions?
No.
Okay. Any past medical history that you will see, like a family doctor, primary care doctor, high blood pressure, high blood sugar, anything like that?
No.
No history of cardiac problems, breathing, other than, like you're not able to catch your breath, any breathing problems where you need an inhaler, anything like that?
No.
Okay, all right. Have you ever had abdominal surgery other than the surgeries you had with Dr. Messick? Okay. Socially, do you drink alcohol right now?
No. I don't do it like every day. Just like social.
Okay, so socially. And do you smoke right now?
No.
Do you use any recreational drug?
No.
Okay. All right. Let me send in Dr. Newhook. Can I take a quick peek at your abdomen, if you don't mind? Any issues with your scars?
No.
Okay. The reason I'm putting on gloves is because my hands just remain cold and they're freezing and people don't like them.
Did you need me to?
No, you don't need to lay down or anything. I do need to see the scars from the other surgery. Okay. Does it hurt when I press on it?
No.
Okay. Do you have a bigger one down here, or this is the biggest one?
This is where
They removed the
the
tumor?
the stoma was at.
Oh, okay, gotcha.
But I think they cut here
Yeah. Okay.
when they originally took out the cancer.
Okay. Good. All right. Sounds good. Thank you. You silly. That made you happy? Yeah. All right, team. I'm sorry you're dealing with this, but I am glad that you have options, which is important.
Okay. Thank you so much.
Thank
You're
you, ma'am.
welcome. Let me send it up to you.
Okay.
Bye.
Bye.
Bebé, estoy grabando todo lo que te digan, pero lo voy a poner en privado, pero por si tienes alguna duda y lo veas después el video, pero lo voy a poner en privado,
Ready, Mom?
porque después se te olvida lo que te dijo la doctora, ¿sí o no?
I'm gonna see another
Baby.
doctor. Yeah.
Ujú.
Are you ready to see another doctor? Are you ready to see another doctor, Mom?
I'm ready to see another doctor.
She's gonna check you with your stomach slowly a lot. Okay? No, come off the tail.
So tienes opciones,
Yeah.
there are options.
Where is that? Paper?
Paper.
You want paper? There's something